So for our live demonstration, everyone, I'm going to need the help of a volunteer, and Tulsi has actually volunteered. So if you don't mind coming up, Tulsi, I appreciate your help here. We're going to do a mock clinic encounter between a patient and a provider. I'm going to play the role of provider, and Tulsi's going to play the role of my patient. Thank you again. Now, I've got a busy day ahead of me, and in the clinic, I'm going to see patients after patients. So I will use Dragon Copilot in my mobile application to document my notes while I engage naturally with my patient, Tulsi. So you ready, Tulsi?
Yes.
All right, so let's do it. So Tulsi is here. She's a 25-year-old female. She's in for evaluation of her left shoulder pain. Tulsi, tell me what's going on.
Oh, I have been experiencing this pain for the last 3 days. I did a heavy workout and then it's gotten progressively worse.
Okay, all right. And then have you injured that shoulder before?
No, this is the very first time.
Okay. And then have you taken anything to help relieve that, or does anything relieve it?
No, not really. It helps if I do a cold compress,
Okay,
but not for very long. The
okay,
pain comes back.
okay, all right. And then do you have any other symptoms? Like, are you feeling any numbness tingling down your arm?
No, nothing as of now.
Okay, great. So I'm going to take a look at you. I'm going to do a physical exam on you real quick. I'm going to actually start with your left shoulder here. Okay, so I do appreciate some effusion on the anterior aspect of the shoulder. You'll hear me say medical terms, but I'll explain to you what they mean later. Can you do me a favor and put your arms out around outside? Like, there we go. Okay, does that hurt when you do that?
A little.
Okay, so there's some slight pain to abduction of the left arm. And then if you put it across you, does that hurt?
Yes, it does.
Okay. So there is pain, positive to pain to adduction of the left arm. So let me go ahead and listen to your lungs and just make sure your heart, make sure everything else is okay. Okay, great. Everything looks normal. I do notice though on your vital signs that your blood pressure is a bit high today. It's 165/88. So is that normal?
Not really. I think I'm just a little nervous about being evaluated publicly.
I understand. So, all right. So let's talk about my assessment and plan. So for your left shoulder pain, my impression is that you are having a left shoulder strain. It sounds like from your activities that you've overused it. So what I'd like to do is a couple things. I want to recommend meloxicam to help with the pain. That's going to decrease some of that inflammation and decrease the pain. And then I would like to start you on physical therapy. So I'm going to refer you to physical therapy for some strengthening and stretching exercises, okay?
Sounds good.
And then for your blood pressure, I just would like for you to monitor that at home. Do you have a blood pressure cuff at home?
Yes, I think I can find one.
Okay, great. And then I want you to follow up with me in 3 weeks about your blood pressure, and we'll also then check the extent of your shoulder pain to make sure that the medication is helping you, okay?
Okay, thank
All
you.
right, thank you so much, Chelsea. All right, so as I stop the recording, I actually now have time to continue with my other work. So I can finish writing up prescriptions, I can place orders, I can even respond to referrals, and then even see my next patient and stay on schedule because the documentation for that particular visit has already been done for me. And then when I'm ready to review the note, I can easily do so anywhere. So Dragon Copilot follows me wherever I go. I can access it through my mobile device. I can also access it through the web or the desktop. So let's go ahead and review that note. So we see here, I see that it looks pretty good. It took all that clinically relevant information, it placed it in the appropriate sections of the note. I don't see any kind of banter that got included. So yeah, I think it's pretty good. If this is all right and I don't need to do any edits, it's ready for transfer to the EHR. Now, Dragon Copilot is adapted to a provider's specialty. So that helps streamline that documentation because with those specialty models, it captures the nuanced details and also structures the notes based on a specialty. So for example, I am a primary care provider today. That's what I played. But if I were an emergency physician, my documentation would require specific charting elements. So for example, they would need to have information like disposition or the ED course or also differential diagnosis. But with the specialty models, I can entrust that my note as an ED physician is going to include all that information. Now, some providers also would like to further optimize their documentation just to add that personal style of documentation to reflect their own style. So I can easily do that as well. So through customization, I can set up to auto run certain personal style changes that I would like. So for example, I actually like my physical exam in a certain structure. So I can easily apply those customization from my library. And this customization leverages generative AI prompts to tell Dragon Copilot of how I really want my output to look like. So you can see here that it added additional formatting. Let me show you the physical exam here, and in additional formatting to my documentation. Now, there are times when also throughout my workflow, I would need to query information about the visit. So about my visit with Tulsa, I wanted to just kind of recall to see what were the patient's symptoms prior to coming into the clinic. So with that, Dragon Copilot actually surfaces information so that I can glean information from the visit, I can glean information from trusted sources right within my workflow. I don't need to go to different places to find that information. It's right here as I am working with this particular case. So I mentioned also that I can tap into trusted sources, grounded sources. So we connect with partners such as Open Evidence and soon to be Wolters Kluwer to be able to really get information on that's medically relevant, right? Or information on diagnoses, treatment plans, and evidence-based content. And how I do that again is through this healthcare optimized capability that's within Dragon Copilot, which is the healthcare adapted copilot. I can ask, for example, what is the first line of treatment for left shoulder stroke? And that will tap out into the connections, such as those trusted sources, and surface that information so I can get more information about relevant like clinical situations that my patients may be experiencing. Now, this also serves as a platform for healthcare organizations to use their own trusted sources. So for example, their internal hospital policies and procedures. So again, it's a scalable platform as well as being able to surface information right within my workflow at my fingertips. And then lastly, I have the capability to create new outputs. So from here, I can quickly draft a visit summary or referral letter from that conversation. It pulls those details. This helps me automate those administrative tasks that James was talking about that many providers have to go through. So for example, I can write a referral letter quickly from that conversation, or I can even extract orders from the conversations. This helps me again with those repetitive tasks that will kind of slow me down during my workflow. Now, you've seen how I was able to streamline my documentation, surface information, and also create new and outputs that is relevant to the case. So I can even use intent-based capabilities to say, give me a list of the diagnoses and ICD-10 codes that's pertinent to this visit. So I can help, complete my work by using all these capabilities. And what this is going to do is allow me to create new outputs or outputs that are needed to really provide the ultimate optimized care for my patients and to make sure that my documentation as well is complete. Now, beyond that, Dragon Copilot also offers a healthcare AI workspace that is extensible. So what that means is it invites plugins and first and third-party integrations and opens up that partner ecosystem. So for example, we can also infuse first-party integration with a clinical conflict scheduling. And what that does is it takes the information and alerts the provider if there's any discrepancies, if there's any contradictions to the medical documentation. And then from that's going to help improve for the physician, improve accuracy and reliability to the patient record. It helps reduce those medical errors. It also helps boost that diagnostic confidence. Another example of extensibility is through our integration with Canary Speech. So Canary Speech provides analysis of voice biomarkers that's captured from Dragon Copilot to detect early signs of cognitive or behavioral conditions like Alzheimer's or anxiety and depression. And then that gives the clinicians timely and also compassionate care. And then Humada is another one that James mentioned, which can provide prior authorizations right at the point of care. So for Humada, for example, they provide prior authorizations and alert providers when they order certain exams, such as or a surgery like total hip arthroplasty. And from there, that accelerates that scheduling, that streamlines that workflow, and then also eliminates those delays in the whole process. So you've seen how we've been able to seamlessly integrate with partners, and we've also seen how Dragon Assistant helps that clinician and empower them to really focus on what matters the most, which is really provide exceptional patient care.